So first, it's probably best to understand what a healthcare agent is and what their role is. They are the person who is legally responsible and allowed to speak for you when you can no longer speak for yourself. It doesn't start as soon as the paper is inked. It starts only when you can no longer speak for yourself, unless you choose, when you complete the document, to have it start at an earlier point in time. For example, some people choose to have it start as soon as they are hospitalized, whether they can speak or not, so that they've got someone who is able to help them through the process of hospitalization. What you need to do is, for the role of the healthcare agent, is they need to be able to communicate with you about your preferences. They need to be able to ask questions and find out what it is that makes you tick. What's important to you, and understanding what matters most to you. Not so much what is the matter with you, but what matters most to you. And that's there's a difference there you need to be aware of, because they need to be able to get into the thick of things as far as who you are, what makes you tick, what your preferences are, what your goals, your dreams. They need to understand who you are. And they need also to be available and willing to speak for you if you can no longer speak for yourself. I will get into that later. They need to be able to advocate for your care as you would desire that care to be. Not as they would desire it, but as you would desire it to be. So they need to be your spokesperson, your mouthpiece, if they cannot speak. And they need to make sure that your goals and wishes are fully understood by the medical staff. And that's not just the doctor, that's the staff that's taking care of you throughout the hospital. Sometimes that can mean a fair amount of work. So they need to realize that if something untoward occurs to you, they have a responsibility to help communicate to the medical staff what it is that you would want in terms of your care.